Hi, everyone. A lot's been going on in my home state of Oregon related to COVID-19, so I just wanted to give a little news report to bring everyone up to speed. On April 30th, Oregon Governor Kate Brown moved 15 of Oregon's 36 counties into the extreme risk COVID designation, effectively shutting down indoor dining in restaurants and bars across the state and limiting the number of patrons to no more than 6 people in gyms, movie theaters, bowling alleys, and indoor swimming pools. People unhappy with Kate Brown's decision took to Twitter and didn't bother mincing words in expressing their discontent for the Oregon governor. Some of the comments looked like this. On May 3rd, the mayor of Sandy, Oregon announced a federal lawsuit against Governor Kate Brown, challenging her extended state of emergency during the COVID-19 pandemic. The group suing Governor Brown includes the Political Action Committee's Oregon Moms Union and Heart of Main Street, as well as the owner of Spud Monkeys, a Gresham, Oregon restaurant that has been cited for violating COVID-19 restrictions. Somewhere amidst the discontent on Twitter and the federal lawsuit filed against her, Governor Kate Brown appeared to backpedal her COVID restrictions and made the last-minute decision to move all Oregon counties out of the extreme risk designation beginning on May 7th. Furthermore, Governor Brown said that her expectation is that there won't be a return to the extreme risk COVID designation for the duration of this pandemic. The alleged reason given for this 180-degree last-minute turnabout was that Oregon's COVID-19 hospitalization numbers increased by only 14.9%, and not the prerequisite 15% increase that would have supposedly justified Governor Brown's decision to effectively shut down select small businesses across the state. In related news, on May 4th, Oregon adopted a permanent rule that indefinitely extends COVID face mask and social distancing requirements for all businesses in the state. Prior to its adoption, the proposed rule prompted a flood of angry responses, with everyone from parents to teachers to business owners and employees crying government overreach. Oregon's Occupational Safety and Health Administration reportedly received more than 5,000 comments, most of which were critical of the proposal, and nearly 70,000 residents signed a petition against the rule. Nevertheless, Oregon's Occupational Safety and Health Administration made the decision to adopt the controversial rule earlier this week, even as numerous states across the country have moved to end their mask mandates. On the topic of face masks, Oregon also made the news for trailblazing a mandatory face mask policy for high school track athletes competing outdoors. This resulted in a track athlete face planting across the finish line as she passed out from not being able to get enough oxygen while running with a face mask on during a competition. This is what video of that looked like.
Now to a near tragedy on the running track. Summit High School student Maggie Williams collapsing at the finish line of her high school track meet while on the verge of setting a school record. She was wearing a mask while running that 800.
This prompted the Oregon Health Authority and Governor Kate Brown to announce a revised mask mandate for outdoor sports. Now athletes in non-contact outdoor sports such as track and field, golf, and tennis are allowed to remove face masks during competition as long as they can stay at least 6 feet apart from other competitors. Oregon has been one of the only states in the USA to require masks for high school distance runners competing in track and cross country. In other news, Oregon State University recently announced that it would mandate COVID vaccines beginning fall term 2021 for students and employees who study or work on campus. OSU interim president Becky Johnson justified the decision by saying high rates of vaccination among our students, faculty, and staff are needed to help improve the safety and well-being of our community. Students enrolled exclusively in online courses and those who do not come to on-site OSU locations are not required to be vaccinated. The university notes that pursuant to state and federal law, allowable vaccine exemptions may be based on a variety of medical, religious, or non-medical reasons, meaning that, at least in theory, medical, religious, and philosophical exemptions for vaccination should be honored by the university. On Saturday, May 8th, there was a rally for medical freedom at Oregon State University, where participants protested the university's decision to mandate COVID vaccines and instead advocated for the university to honor the foundational principle of informed consent in medical decision-making. I asked one of the participants at the rally what they thought of OSU's decision to mandate COVID vaccines, and this is what they said. So what do you think of OSU's decision to mandate COVID vaccines for students, staff, and faculty starting fall term 2021?
I think it goes beyond anything that I've ever seen before. It violates personal choice. It violates the responsibilities we each have to take care of our own bodies, put things into our bodies that will benefit us. And for the students that attend here, how can you say that this is the best for them when they are the least at risk of damage from the virus? And what about people like myself and my daughter who have already had the coronavirus? What will you say to us? What will you say to my husband who works here and has been completely exposed to the virus, yet feels manipulated and coerced into giving in to this demand in order to maintain his livelihood?
Thanks for listening. That's the Oregon COVID News Report for now. Have a great day.